Hey, vcehealth students, my name's Andy. I'm a VC Health and Human Development teacher. In this short video, we're going to look at sociocultural factors and youth health outcomes. This is relevant for Unit 1 in the 2025 plus vcehealth study design. If you don't already, you can see there's a range of ways that you can engage with the Health Resources Hub. If you're on YouTube at the moment, please subscribe to our YouTube channel using the button in the bottom corner of the video there. That means you'll get alerts to all of our new videos coming out across the year. We've also got our website, the hrh.net.au. There's opportunities for HHD students and teachers. You can see there we've got our Instagram as well as our TikTok, Facebook page, and our email. If you follow us, you'll get alerts to our new videos and other HHD opportunities. Okay, so what part of the course does this video relate to? So you can see the Unit 1 key knowledge and key skill that this is relevant for. So the key knowledge talks about sociocultural factors that contribute to variations in health outcomes for youth, and then they give some examples of relevant sociocultural factors there. So it's important to note in that key knowledge point that it mentions variations in health outcomes for youth. So variations is essentially talking about differences. And that term health outcomes refers to either health and wellbeing dimensions or health status indicators. So you should be able to link these examples of sociocultural factors to how they could contribute to differences in either health and well-being, okay, or health status for youth. And we'll look at some examples of that in this video here. And then the key skill mentions that you should be able to explain and analyze a range of sociocultural factors that contribute to these variations in health outcomes of Australia's youth. So, to begin with, what are sociocultural factors? So, these are the social and cultural conditions in which people are born, grow, live, work, and age. So, that's a description. And then there's a huge range of these sociocultural factors. And if you move on into Unit 3 and 4 HHD in the future, you'll see that there are a number of others that are covered and relevant in that aspect of HHD. But we're just going to stick to the ones that are mentioned in the key knowledge point here. You might cover some additional ones in class, but these are the ones that are mentioned in the key knowledge point. So I think these are the ones that are best to, at least as a basis, have knowledge about. And so for these sociocultural factors here, you should be thinking about, well, for youth, so young people in Australia, how could these particular factors influence whether or not they're likely to perhaps develop some health conditions or some health issues, and then how those health conditions or issues could have an impact on their health and wellbeing dimensions or health status indicators. So, for example, you can see one of the sociocultural factors mentioned there is education. So you could think about, well, if there are some youth that have lower levels of education, what might that mean? Well, it might mean that they might have less knowledge about the risks of engaging in activities such as smoking, and therefore they might be more likely to smoke. And so for those youth in Australia, that might mean that they're more likely to develop, say, mutations in their cells and develop cancer, such as perhaps, throat or mouth cancer or lung cancer or a range of different types of cancer. And so that means that if you were sort of comparing groups of youth, so groups of youth that do have lower levels of education might then be more likely, okay, to develop a range of different types of cancer if they were, less knowledgeable about something like smoking and more likely to smoke. And so you could link that to a range of different, I guess, examples if you're using education as your factor. So why I think that is useful to think about it in that way is that then I guess provides you a bit of a springboard to link into either health and wellbeing dimensions or health status indicators. Because if you are talking about young people who are more likely to develop cancer, well, that could obviously have a significant impact on their levels of stress and anxiety if they became unwell, and that could be negative for their mental health and wellbeing. Or you could link that to an increased incidence of cancer in young people, and that's obviously linked to health status. So as part of your notes, I'd be thinking about setting up perhaps a table or a section of your notes where you're going through and you're thinking about, okay, well, if young people for peer group and family, education, income, and health literacy were more likely to have higher levels or lower levels of this particular factor, what might that mean in relation to some health conditions or issues that they might develop? So you can see here, I've given a bit more of a detailed health literacy example. So health literacy relates to people's ability to access, critique, understand, and use health information and services in ways that promote and maintain health and well-being. well-being. So essentially, it's young people, when we're thinking about health literacy in young people, their ability to engage, I guess, in health information and the health system and health services. And so then you might set up some kind of table like this and think about, well, how could I link that to health and well-being and health status? So on the left there, down the bottom, it says youth with low levels of health literacy may not understand health promotion messages such as the importance of managing stresses, and that could contribute to stress building up and causing anxiety and panic attacks, reducing mental health and well-being. So you could think about it in relation to low levels or high levels, and you can see there's another example there on the left at the top of the table for high levels. And then on the right for health status, if we start with high levels of youth health literacy, that means young people are more likely to understand health promotion messages, the risks of taking illicit drugs, and that might reduce, the likelihood of this behavior and reduce their risk of premature death from drug taking, increasing life expectancy. So this is what I mean in relation to each of these factors, thinking about how it might contribute to differences in youth health and well-being, health status. And that's what we're talking about in relation to those sort of impacts on health outcomes. Now, if you were trying to link into variations in health outcomes for youth, what that really means is that youth don't all experience health and well-being and health status equally. So that's what that term variations is linked into. And as we mentioned earlier, health outcomes is about health and well-being and health status. And so that depends on a range of circumstances and factors that might lead to some youth being more likely to develop health conditions or issues than others. And that can then impact on their health and well-being and their health status, contributing to these variations. So once again, you might like to set up a table like this as part of your notes and go through and hypothetically think about for these different sociocultural factors. If we did have, say, a youth population A and a youth population B, and these could be perhaps in sort of different areas of Australia. So in theory, A could be maybe youth that were living outside major cities in rural remote areas, and B could be youth that are living within major cities. And so that information could be presented to you in, say, a SAC or an exam at school. And then you might have to think about, well, if one population of youth did have, more supportive peer group and one had less supportive peer group, what might that mean in terms of a variation in health status and health and well-being? So doing it in a table like this means that you'll have already spent some time perhaps thinking about this. So if it did pop up in, say, some data in this SAC or an assessment and an exam, then you can think about how you'd apply your understanding. So you can see there for peer group, I've said population A experiences a more supportive peer group than population B. The next column then is linking that to a health condition or issue, and then linking that into a health and wellbeing dimension. And so it says there, with a more supportive peer group, population A may have a range of friends to share their day-to-day worries and concerns with, and that might reduce their levels of stress and anxiety about, such events compared to population B. And then over time, that might contribute to a lower incidence of mental health conditions in population A compared to population B. So you can see there, you're just trying to think about the difference in that particular example of sociocultural factor for two different youth population and how that could be linked into either health condition or health issue and health and well-being, and a difference in either that health and well-being dimension or even a health status indicator between those two populations. Okay, hopefully you found that useful. Unit 3 and 4 students, you can head to book.acevce.com if you're interested in this revision questions book that I've worked on with ACE. But Unit 1 and Unit 2 students, you could head to our website, thehh.net.au, where see there's more opportunities for HHD students and teachers, and hopefully found this video useful. Thanks so much.